Good evening, and thank you for joining us for our workshop on how to survive quarantine without us, also known as your chiropractors. We're so glad to have you here this evening. Tonight, we are going to go through some awesome stuff that you can do at home to be able to help with some acute pain, including we're going to start by talking a little bit about why stress increases pain. I'm sure you'll all agree that we're under a lot of stress. Therefore, we have a lot of people that are suffering with pain right now, and that's why we wanted to do this workshop for you guys this evening. So we're going to talk about that. Then we're going to go through some at-home pain hacks that can actually help you handle your acute pain. So we're going to go over some specifics such as trigger point work. So how to find those nasty knots in your husband or your wife's shoulders and try to work those out. And we're going to go through some muscle work and different stretches that you can do to be able to loosen up those tight muscles. And we're going to reveal a very popular kitchen tool that you can use to be able to loosen up some of those tight muscles. As a matter of fact, right now in the comment section below, please post any thoughts you may have as to what this tool may be. What could it be that could be used to loosen up some really tight muscles? So put that in the comment section below. So my name is Dr. Shirley, for those of you that may not know me, and this is my husband, Dr. Joe, and I am so excited because those of you that are regulars on our station know that Dr. Joe usually hogs the stage, and I'm so happy to have an opportunity to speak tonight.
Too. Here we go.
And so we're going to have a lot of fun tonight. We hope that you guys enjoy your time with us. So make sure you grab your partner, grab some lotion, and make sure you have some comfy clothes on so we can do our stuff. And what I want you to do right now is, if you could, let's have a little bit of fun with this. Please take a little selfie of yourself and your partner and post that in the comment section below so we can see that you are ready to get going here. All right, so first of all, just some legal stuff. Just want to make sure you all understand that this is not intended to be medical advice. Please make sure you consult with your doctor before doing a new exercise, stretching, or self-therapy program, especially with a pre-existing injury. If any of this stuff that we're going to show you this evening hurts, stop. Okay, you have to use some common sense, and if you have any condition that you know you should not be doing this type of thing, which we're going to go through some conditions that would prevent you from doing that, please make sure that you abstain from that. So let's start by just talking about what stress is. Stress is a heightened response to a routine or out of the ordinary condition and event. So basically, it's how our bodies respond to having some kind of external thing that you're not used to having. Like, for example, the coronavirus. Are you used to living in a state of fear of the coronavirus? No. So your nervous system gets into a heightened state of alertness because your body's purpose is to be able to protect you. So it actually goes into a heightened sense heightened stress state so that your body can try to protect your life. So what are some areas that can actually cause stress? Well, your job, money, relationships, children, junk food, medical drugs, even though they may be necessary, they still can stress your body. And also, I'm going to add one little extra one in there, the coronavirus, because if that doesn't raise your blood pressure, then not much will. So to avoid stress, you would absolutely have to avoid life, and that we know is just not possible. So what we're going to do is just teach you how to better handle that stress. So there's 3 types of stress. There's physical, chemical, and emotional stress. So physical stress are accidents, injuries, postural issues, dropped foot arches, pinched nerves, muscle tightness, and weakness. Now, if you take a look at this guy over here in the corner, he's all hunched over. Looks like a lot of you guys at your workstations at home, okay? Because some of them aren't set up properly. You're just sitting at them for many, many hours at a time, and your body's getting very stressed. That is a physical stress. Chemical stress. Chemical stress is when you put things in your body you shouldn't, and when you don't put things in your body that you should. So in other words, you're not eating well, you're putting bad things into your body and not getting the nutrients that you need. And then the last one is emotional stress. This is the one that most of us are significantly experiencing right now during this pandemic. And this is the most common type of stress that people will think of. So what I want to do right now is we're going to actually go through and analyze how much stress you're actually experiencing. Not that you really need to think about it, but it's kind of neat to see exactly how many of these symptoms you may be experiencing that are the direct cause of stress. So what I want you to do is, as we're going through these different symptoms, I want you to count how many of them you actually have and then post them under the comment section. We're just going to have a little fun and see who's the most stressed out, okay? So please play with us. So here we go. Number 1, headaches or migraines. Now, even if you take a drug to prevent them, I want you to count this as having the symptom, because you really do have the symptom. The drug is just making your body feel like it's not there. It's just covering it up. So, number 2, fatigue. All right. So I know normally when you're watching these presentations, Dr. Joe puts you to sleep, but you should not be tired right now because I'm an awesome speaker. Just kidding. All right. So if you are experiencing fatigue, then you need to definitely count that. The next one, pain, tension in the shoulders, the neck, the lower back. Now, most likely if you're watching this tonight, you're here because we're going to teach you how to handle pain. So I can almost guarantee you have that. Irritability. Now you can nominate your partner if you'd like in the comments section. You can just rat them out, say that they're being grumpy if you'd like. But if you are irritable, then you got to count that one. Sleep problems. So trouble falling asleep, staying asleep, or not feeling rested when you wake up. Allergies and sinus problems. This is a big one this time of year, okay? So mark that if you have that. And digestive trouble, okay? Might be constipation, diarrhea, gas, bloating, any of that fun stuff. Now, lowered immunity. Now, this is a scary one this time of year with the world in the state that it's in. You do not want to have a lowered immune system, but that is definitely a sign of people that are stressed. So that's why we got to teach you how to not be stressed. Loss of libido, hair loss, weight gain or loss. Now, some people under stress gain weight because they eat like crazy, and some people lose weight because they lose their appetite and they just stop eating. Now, either of these can definitely be a sign of stress. So, what was your score? Please post it in the comments below, and we're going to see who got the most and won. All right, so we're going to talk now about how to reduce stress on the musculoskeletal and nervous system. So your nervous system can be damaged by the following: auto accidents, poor posture, remember that messed up workstation we talked about, birth, that's either giving birth or being born. Believe it or not, babies have a lot of trauma to their musculoskeletal and their nervous system when they're being born, especially if they're in weird positions. Falls, sports injuries, repetitive motion injuries. Repetitive motion injuries are the clicks of the mouse time and time again. Texting constantly. You're doing the same motion over and over again, causing damage to your joints. And eventually that physical stress will result in pain. It's just a matter of time. That's why it's important to try to break those cycles and not be constantly doing those motions time and time again. Get up, take breaks, do what you can. So the stress leads to tension in the muscles and the joints. So think about when you've been stressed and you feel yourself tense up. Next thing you know, it alters normal structural alignment of the spine. So I'm going to show you here. If you take a look at this model spine, you have muscles that attach to each side of your spine. When you get tense, those muscles tighten. And what can happen is that bone can be pulled out of place, causing an impingement of that nerve. Okay, now the nerve is trying to send signals from the brain out that nerve to the rest of the body, and now you end up with either a decrease in function wherever the nerve is going, or you can actually end up with pain. And that's what we're talking about actually this evening. And then lastly, you end up with an irritation and heightened sensitivity of the nervous system, okay? Did you ever hear the saying, "you're getting on my nerves"? What does that mean? It means like, one more word and I'm going to blow up because my nervous system just can't handle anything else. And that's exactly what we're talking about with heightened sensitivity. Okay, so it all starts with the biomechanics. That's where it starts. Your biomechanics is your posture. It's how your body functions as you're trying to go about your daily activities. So a really good example of this is having a pebble in your shoe. Okay? Having a pebble in your shoe is a really good example of how that pressure can get put on the nerve. So if you have a pebble in your shoe, it irritates the nerves in your foot, causing pain.
Hey, Dr. Shelley?
Yeah?
I'm sorry to interrupt, but I think I have a pebble in my shoe, actually.
What?
It's been driving me kind of crazy, but for most of the lecture, it's been great because, it was keeping me awake while you were talking.
Yeah?
But, now it doesn't really serve a purpose because it's just driving me crazy. And it's
Oh my
distracting.
goodness.
So, I don't know. What should I do?
Well, I was just about to get into that, so first of all, I was listening to the news this morning. They have this new drug called. So you want to try that?
I'll try anything.
All right, let's do it. All right, so just take those.
Chewable.
Yeah, nice. How's it feel? Is it better?
No, not really any different.
No?
No.
Oh, false advertising. All right, well, you know what?
Got anything else?
Yes, have a seat for me.
All right.
Now, I also heard about this new surgical procedure called a
really?
pebblectomy. Yes. So what we're going to do is I'm going to take your shoe, and I am a professional, folks, so please do not try this at home.
It's not going to hurt, is it?
Maybe.
Not you, at least, right?
Toughen up, Buttercup.
All right, I'll try.
All right, so let's see. We're going to make a nice little hole in here, so hopefully that pebble will come right back out of that shoe. See if that works.
Let me try it. Okay. No, it's still there.
Are you kidding me? Why do you have to be difficult?
I'm sorry.
I'll tell you, husbands.
I know it's not very professional, but can you just give me a minute? I got to take this thing off. It's
All right.
crazy, okay?
Technical difficulties. Do 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 do.
Oh my goodness! I think I figured out why it was bothering
Really?
me so bad.
What?
I really did have a pebble in my shoe.
Well, look at that. Wow, brilliant. Give him a hand, folks. Yay!
I'll feel better. Let's get a new one here.
Awesome. Wow. He's really top-notch actor over here. Awesome. All right, guys, but you get the point. If you have a pebble in your shoe, it's going to hurt your foot. But the problem is, okay, that example of like the pinched nerve. Can you grab my spine?
I can.
See, that pebble is like having the pinched nerve. So when the bone is shifted out of place, right? Boom, there it goes. That gets pinched. Now, unfortunately, the only way to really remove that pinched nerve is by seeing a doctor of chiropractic. But during time of quarantine, of course, you're not really able to do that. Now, we're blessed in our office. We are able to remain open, so we can see people that are in a lot of pain, but we can't see regular maintenance patients. But your chiropractor may not be open. Maybe you're really miserable and you don't want to go to the ER because you don't want to get on addictive drugs, and you certainly don't want to go and get exposed to COVID-19. So bottom line is you got to do something. So what we're going to teach you today is not a permanent fix. It's actually just something you can do to be able to just take a little bit of the pressure off that nerve and hopefully get a little bit of relief until you can see your doctor of chiropractic and actually get the problem handled. Okay? So what can you do? Exercise. Exercise is very important. When you're out moving around, you're loosening up those muscles and relieving some of the tension that's going to be on those bones, hopefully alleviating some of that pressure. A recent study followed 40,000 postmenopausal women for 7 years. Those who regularly engaged in moderate activities had a 41% lower death rate than those who did not exercise. Now, if it lowers your death rate, do you think it might lower your pain level? I would venture to guess yes. Go for a walk. California State University found that a 10-minute walk is enough to increase energy, alter mood, and affect a positive outlook for up to 2 hours. If it's going to make you feel emotionally better, it's going to decrease emotional stress, which decreases the tonicity of the muscles, which therefore can alleviate some of that pressure. So definitely go for a walk, laugh, and have fun, okay? Just watch Dr. Joe and I pick on each other all day. You can binge on all of our videos and just laugh all day long, except when he gets all geeky on you, but we love him anyway. All right. So to reduce the harmful effects of stress, one should eat a healthy diet. Eating foods that are anti-inflammatory, not things like sugar that are going to increase inflammation. Exercise regularly and make sure your spine and nervous system are functioning normally when possible. So now we're going to get into the hands-on portion of the program. So we're going to switch over mics here for Dr. Joe. He's going to take over and talk about what a trigger point is, and we're going to show you how to actually treat those. So just give us 1 second as we switch over our mics.
positions.
He just wants to hog center stage again.
That's my thing. All right, mic check 1, 2. All right, here we are. So, what are trigger points? This is such a key part of this. Basically, replace the word trigger points with knots, okay? So, ultimately, you don't have to worry about the fancy terminology, but they are hyper-irritable areas of contracted muscle fibers that are palpable nodules. That means that they can be felt by your fingers, okay? And we're going to skip down to the bottom here. It's also areas where waste products are being built up because of restricted blood supply. So when there's a knot in the muscle, the blood flow can't go through it. It's kind of like a river trying to go through a dam. It just has to stop. It may go around it, but ultimately it's not going to be as efficient as it would be going straight through it. It's the same kind of situation with trigger points, these nodules we're talking about. All right, so let's go on to the next slide here. So symptoms, this is important. A lot of people go to their doctors for many of these symptoms, and believe it or not, tonight you're going to understand how to self-treat, how to self-support these things at home, or have someone assist you with it. So it may be a dull ache, just a low-grade discomfort, maybe a deep pressure, or that pressing pain in there. It's like this thing you just can't reach. Almost like an itch you can't scratch. It's almost like a pain you can't reach by pressing on it. Stabbing sensation, it can be very sharp, and that can actually be scary when that happens. People can think that something's broken or some major things going on, but it may be a nerve being impinged. Burning sensation, kind of a broader discomfort that's going from it, or a referred pain. This is a term we use a lot. Referred pain means, for instance, when we're pressing on a shoulder muscle, that pain may refer up into like the eyeball and head area, thinking like it's a headache, something from here, but it can be a foot or 2 feet away from it that's the cause of the problem. So understand that anything can cause anything, and you're going to understand that a little bit better as we talk about trigger points here. So common reports are headaches, dizziness. Believe it or not, a lot of people, I think they have like crystals in their ears, or like those little, basically crystals that are stirring around in there, causing dizziness sensations. And doctors often have to prescribe medications. In many cases, there's a tight muscle on the side of the neck called the SCM muscle, and that can be a large part of what's going on in there. Or people get pins and needles or tingling down into their arm, thinking they have carpal tunnel or some symptom like that, but in fact it's pinched muscles up in their upper back and neck. All right. So why are they present? Well, repetitive overuse injuries. This is huge. It's what you do way too much every single day. It's the thing people say, well, I don't know what caused this pain. And it's usually the thing you did yesterday and the day before and the 1,000 days before. It builds up over time, and eventually it can cause that to occur. It's even typing on a computer or using the mouse all day long, one arm might get a little bit tighter than the other side. And all the things you do around the house all day. And we can see someone like this say, oh, well, that makes sense. We can see why that guy would strain himself. But in many cases, it's the small things. But obviously, lifting something too heavy can be a big issue, including a purse for a woman or a briefcase, or a book bag for children or anyone that carries a book bag around. All right, so why are they present as well? Poor posture, huge. This is a big part of it, and ultimately that is one of the first signs. You can see someone just having this chronic stress on their body. They stand or sit like this, and when they're sitting on a couch, they're slouched like that, and then they stand up and they feel crippled in some way. So that's a huge thing. Direct injuries, obviously sports injuries, falls, car accidents, things like that, big players as well. So trigger points can develop even just having too much time in bed rest or couch rest or Netflix binging or whatever else that you're watching nowadays, way too much of, and not getting out of that position. That can cause trigger points to occur. So you might feel worse now than you did when you were active, and that's basically why we want to help you to get through it. All right, so post-treatment irritation. So as we're going to work on this tonight, we're not just going to show you things. We want you to do this at home. We're going to grab your partner in a few moments and going to start showing you how to do this. But as you do it, realize you may have soreness. Just like if you go to the gym, you may be sore like 2 or 3 days later because of that lactic acid that's in the muscles, and realize that's kind of a normal thing. Side effects.
Don't blame your husband or your wife.
Yes, exactly. Blame Dr. Shirley because she's the one that set this lecture up. Okay, just kidding, of course. All right, but side effects can include bruising, redness, tenderness, increased sensitivity, increased symptoms, or aching similar to DOMS. So basically that's just a fancy term for over-exercising and that lactic acid that's produced from it, okay? Contraindications. There's a few here. Believe it or not, there's not really that many things that would prevent someone from doing this, but it is important for us to explain these because you don't want somebody doing something in an area that's going to cause harm to the body. So acute conditions requiring medical attention, of course, you wouldn't want to do that. Acute pneumonia, advanced kidney, respiratory, or liver failure, because there's circulation issues associated with it. Diabetes with complications such as gangrene. Obviously, tissue that's starting to break down because it doesn't have a blood supply. Advanced heart or kidney disease or very unstable high blood pressure. You don't want to be pressing in areas with increased pressure on those blood vessels because it could cause damage. hemorrhaging, which is already excessive bleeding, severe atherosclerosis, hardening of the arteries. You don't want to rub over something that's got plaquing in the arteries. Severe unstable hypertension, shock from some major trauma, systemic contagious or infectious conditions. Obviously, if somebody was sick with something, you would not want to be massaging them because you're going to spread that disease or infection. On the local side, acute flare-ups of an arthritis. So if someone's got a really aching shoulder, they know that has something to do with their arthritis, and you don't want to be pressing in that a lot. There's already a lot of inflammation. Maybe it even has visible redness already. Aneurysms that are deemed life-threatening. So some people can have aneurysms their whole life. They've been checked out. They're safe. But if they've been shown to have extensive enlargement and maybe they're not so stable, you would not want to be working on that for sure, in that location at least.
And never press over a blood vessel. Something that's pulsing, don't ever...
Yeah, if you feel a pulse, that's definitely not a good sign. Okay, like someone feels their pulse like here and like that, that's not an area you would want to be rubbing because you're massaging an artery or at least a large vein. Okay, local contagious conditions. Okay, local irritable skin conditions. So that'd be if someone has like chicken pox or shingles, which is, like an adult getting that infection, or like if you had a poison ivy, you wouldn't obviously want to be working on that. Malignancy, that's basically cancer that's spreading throughout the body because you don't want to increase circulation in that area, causing it to spread further. An open wound or sore. Recent burns, whether it be like a really bad sunburn or a burn from like a fire or a stove or something, or an undiagnosed lump, something that just does not look or feel right. It probably isn't. Do not try to massage it. Talk to somebody about that. All right, so the trapezius. This is one of the most popular areas to work on in the human body. Okay, so we're going to show this one in a moment. And ultimately what it is it's in large part from posture. And you can see this person up here, okay, with skin on normally, of course, but this is showing like a bisection of the muscles there. And the spine has this exaggerated shoulder leaning forward and head going forward. But a lot of people say that they're getting shorter as they get older. In many cases, they're just slouching more. If they were to stand up straight, they're going to gain an inch or two. But it puts tremendous amount of stress and tension on those muscles, and we're going to try to figure out how to assist those. Now, in many cases, people do not realize how tense these muscles are. As soon as you start working on somebody, you will find, oh wow, that's actually a little painful, but it also feels good at the same time. So poor posture, stress, carrying heavy handbags like we talked about, dysfunction of any sort, okay, shoulder problems, symptoms are that achiness in the body, just tension in general. And you can see a person here carrying a purse, in many cases, they're elevating that shoulder to try to maintain that on their body, and it's going to cause tremendous amounts of tension in there. So I want to show you where these actual trigger points are. So there's different parts of them, but ultimately the upper trapezius and middle and lower trapezius have this kite-like shape to it. And you can see these different dots here can represent where the different trigger points are. So we're going to show you that right now, how to find them and how to work on them. Now, I will tell you, back in school, when we first did this, like over 23, 24 years ago now, the first class we took on trigger point therapy, all of us thought we were complete losers and we would never become chiropractors because we could not feel anything. They were trying to teach you how to find a muscle, and we weren't even sure if something was a bone or if it was a muscle or what it was, okay? It did not take very long to start to get a good sense of what that's like, okay? And ultimately, that's our goal here tonight, is to get a starting point on this. A couple things, little housekeeping things. Men sometimes have really strong hands. Wives often do not like them to be squeezed very hard when you work in these trigger points. I get this all the time when I work in women. My husband squeezes way too hard, and that's not a good thing, so we don't want to do that. Sometimes I squeeze way too hard, but I have a good sense of knowing when you're supposed to stop. A good way to do this would be if you were to position a mirror right in front of the person while you're doing this, okay? You don't have to do it right now, but you can actually look to the side to see if they're cringing. But as you're working on the muscle, if they're squirming and they're kind of pulling away from you, that's a good indication it's a little bit too hard. In many cases, a man or a woman may want a lot more pressure, and the other person may not have that thumb strength or finger strength to do that. And I'm going to show you some points that you can use, like with your elbow or forearm, to put a little bit more of your body weight in it without really putting tons of stress on your hand joints, okay?
So communicate how you like it done.
Yeah, so the person needs to be their attention. So just because you like it really deep in there does not mean the other person does, okay? So we're going to start with the upper trapezius, one of the favorite muscles here. So it'd be like if someone just came up to you and kind of placed their hands on your shoulders. It's where your thumbs are going to fall into place here. Just turn a little bit further for me. So it's just right off the collar here, a little bit below that, just above the shoulder blades here. If you find the bony part of the shoulder blade and you work your way up towards the neck a little bit, you're going to start to get right into the middle of the upper trapezius. Now, I've worked on my wife's shoulders a few times. In fact, you might have saw her video earlier today. She had that pinched nerve in her neck when she was getting out of bed. Okay, we were obviously joking about that one. but it can happen. And the tension that builds up here is significant. So what you want to do is you want to poke around with your finger and use one side at a time just to kind of put your attention on it. And as you feel something, press in just a little bit firmer, 20-30% more pressure, and ask the person, does that feel a little bit uncomfortable when I press in there? Okay. And then poke around until you find a spot where they're like, oh yeah, right there, that's the spot. Where if you press a little bit firmer, that it kicks up a little discomfort, but it feels like that good kind of pain, not the bad kind of pain. And you might want to compare to the other side just to see if it's like a bone or it's exactly the same thing over there. But when I get to her left side, it's far worse than the other. And she told me that thing because she's a good patient. She wants more of this and she wants to direct me well. So what I would do is this. I'm going to show you how this works. I'm going to basically put just straight in pressure, like if I was trying to squish like a grape on a table. And I'm going to push into that. And sometimes these are the size of grapes. Sometimes they're small, like a peanut. And other times they're as large as like a clementine or some kind of orange like that. They can be huge. And the person may not even know they're there until you start working on it. So as I'm working on this, and like I said, please do this as we're going through it. So find one themselves. And what you want to do is press straight into it with about 50% pressure, maybe less than that, until the person's like, how does that feel? Is that comfortable? A little too much? She kind of winced a little bit. I got a little too intense there, overzealous, okay? So I back off a little bit, and I just hold that pressure for 8 to 10 seconds, reminding the person to breathe as they do this. This is key, because it's the out breath of that often allows that muscle to relax the most. And you do this for like 2 or 3 breath cycles, and out, and then basically you let off. That's important to let off eventually. Don't hold it for 2 minutes. What happens is as you're pressing on it, you're reducing blood supply to the area as you're breaking up that knot. And you can press straight in, or you can press in there and wiggle around just a little bit to try to break that up, like you were smushing it. But it's important to let off so that the blood supply you've been restricting can now flow into the area, flushing out some of those toxins that are stored up in there, that lactic acid and other inflammatory components. We've heard a lot about COVID and inflammation and the cytokine storm and all these other things. That's excessive inflammation in the body. Well, in any part of the body that there's injury or chronic issue, there's usually inflammation. So we want to go in just enough to irritate it to get some circulation in there to flush out those toxins and the inflammation. And ultimately afterwards, or as we're going to talk about, it's important to ice, okay? If you're sore, you definitely want to ice that. But the thing here is you're going to do this like 2 to 3 times, 8 to 10 seconds, again, breathing a couple times, okay? And like I said, every time she breathes, there's this little extra relaxing on the out breath that allows that to relax more. And then if I was to do this, really intensively for 2 or 3 cycles, actually just by even this little bit that I've been doing, this muscle is even breaking up. And what you want to do is follow the muscle. So if you want to look up online, so we're working on the upper trapezius muscle. Okay, so there's one knot. You don't want to work on one knot the whole time. The muscle actually extends along the whole area of the body. So you can literally look up upper trapezius muscle and see like where the whole length of it is, or just feel around until you feel these knots. Depends on how geeky you want to get with this thing. My wife got out the lotion. She's very excited. She thinks she's going to get a full body massage now, of course. But ultimately, why she did that is sometimes after you do this, you want to just get a little bit of lotion, not like a whole handful where it's going to be loose, massaging it, because your hand's sliding all over the place. Just rub it in there a little bit, and then what you can do is slide along the muscle a little bit with the lotion in there, just to kind of push some of those toxins out of there to get some increased circulation. And what I'm doing is I'm going from side to, end to end, from muscle beginning to end of it, working through that muscle, and it'll feel great. And you'll make a very good friend there. So if the person's been grumpy recently, they will probably chill out a little bit afterwards. And maybe now's the time to say, hey, honey, can you make me my special dinner tomorrow night? That'd be great. You can really get a lot of good brownie points during this, just so you know, guys. You might get 1 point, and that's about it, but good luck. It's helpful to get that much, okay?
And start gently.
Gently.
And then increase in pressure if your partner wants you to.
Yes. Okay, don't feel like, okay, I'm going to do this for 20 seconds and be done. I got to go watch the game, which right now you can't watch anyway. So who wants to watch an old game from 4 years ago? Okay, so take your time now when you got some free time at home. Work on this, because guess what? If you help them, they'll be less grumpy. They'll also work on you. So when you get home, you're like, oh, I got this kink in my back. Well, guess what? If you don't do a good job for them now, they won't want to help you as much later. Of course, they're very giving, but either way. So that's one great muscle to work on, is the upper trapezius. There's a lot more muscles along the side of the shoulder blade, like the rhomboid muscles you can also work on. Those are great. But for simplicity, we just wanted to show you that one muscle group in the upper body right now so that we can get a little bit into the lower body to show you some really important muscles there as well. Okay? So you can move that over to the side, please. All right, so we're not going to be doing bench press here right now. We're going to use this for, I'm going to go sideways. I'm going to do this. Slide that over to the side, please. Little technical difficulties. If I pull my muscle now, that won't be good. All right, so we're going to work on the next one here, which is, where's my clicker? All right, the TFL muscle. It's not the NFL, people. This is the TFL, all right? So the TFL is a muscle that has a lot more impact on a lot of people. It affects the side of the hip. So if you have hip pain or back pain, in many cases, you're going to find that this muscle is actually involved. Other people have heard of the IT band. The IT band is a tendon that goes from the end of where the TFL connects on the hip down the rest of the leg. So it's kind of a combination of two areas, but it's a nice area to work on because it can be very tender. Why is that good? Because you can find it easily, work on it just a little bit, improve that hip motion, which will affect the sacroiliac joint, that sciatic nerve pain that a lot of people experience, low back pain. The sky's the limit. Work on this thing. It can make a major difference. If you're a runner or if you sit a lot even, any of those muscles can get tight from overuse or underuse, okay, because they get short over time. So what you want to do is, right about here where the hip bone is, you want to go just a little bit above that. And what's nice is with this one, you can use both fingers at the same time and poke around until you find a little bit of a knot. And actually, this whole thing's a little bit tight in a couple spots.
Am I a naughty girl?
You're a naughty girl. Knotty. All right, so right there, I can press on it and know that I've got the spot because she kind of winces a little bit when I do that. So what you want to do is press straight down just a little bit in there. And hold that spot for a moment. Maybe wiggle around a little bit. Remember, keep breathing as we do this.
Can I fall asleep?
If she falls asleep, we'll see if she falls off the table. All right, work on that. Give her a few seconds. And remember, it's about 8, 10, 20 seconds in between. Let the blood supply go back in there. Okay, again, go a little bit around that area. Find another spot. Again, I'm using 2 fingers like this. This is an area, it's a big muscle group. You may find that your thumbs aren't strong enough to do that. So what we're going to encourage maybe is that little knobby point there, your elbow. You may want to consider doing that. So what you want to do is use your finger to find it and then lean in gently, very gently, because the pressure from your elbow can be 10 times the amount of your fingers very easily. And just press in a little bit till you feel that spot. Okay, she's saying yowza. Okay, that's French for take it easy. All right? It's tingling down her leg a little bit, which is called a referred pattern, because that nerve, actually innervates a larger supply of air. Back off of that, give it a little bit of time. Okay, there's now another extension of that, like I said, the IT band, which is huge, okay? So we worked on the trigger point here. Hopefully you had a chance to do that. Often in the glute area here, a lot of those knots, or what's called the piriformis muscle, can be a very, very tender area. A lot of people that have chronic sciatic nerve pain. I had herniated discs in my back for 2.5 years. It was killing me. I had constant sciatic nerve pain. But after the disc herniations healed, and they did, I had chronic nerve pain because of the muscle being tight. So I had the same exact symptoms, but one was from the muscle and one was actually from herniated discs. So that's important to try to clarify what that is. So your chiropractor, or massage therapist might be able to help you to figure out what that is when you're figuring what to do at home. All right, so now we're going to go on to figuring out what kitchen tool can be very helpful in significantly decreasing pain. All right, so earlier on we asked you to leave some comments. Hey Trish, did they leave any good comments there? Any good guesses? Did anybody get it right?
We had at least one that said a rolling pin.
All right, rolling pin it was. Good job. Okay, because we didn't want you to get confused. In this picture, it's not the pumpkin pie or the apple pie that is the kitchen tool. It doesn't mean go make one, all right? It's the rolling pin itself. It's flattening out that dough, okay? Well, guess what? When there's knots in the body, you want to try to flatten those out. And some of them are a little bit harder to work on. So a person might use their hand like this and try to massage along the muscle, because that muscle goes right from the hip down to the leg here. This one has tremendous contribution to hip pain and knee pain. I can guarantee there's a large percentage of people out there, probably 20 to 50% of people, that are literally contemplating getting knee replacement or hip replacement, that it has everything to do with this muscle. I've seen people days away from hip replacement surgery, at least scheduling it, and 2, 3, 4 visits working on this muscle, and they're walking completely normal again. And this could be 80, almost 90 years of age when this occurs.
This is big for truck drivers. I had a truck driver one time,
couldn't walk hardly at all and work this out.
So what she's saying is truck drivers often have this because they're static in the, they're shifting, depending on how the gears are set up in the truck, if it's auto or not, and they're using their legs a lot and they're in chronic sitting position. So these muscles can be awful, okay? And often you don't feel it in the muscle. You feel it at the hip or at the knee, but not in between. But when you start using a rolling pin, you will feel this muscle, okay? And you will never forget it because it can be very tender. It's not used to being worked on. So the key is you often want to palpate, find out where these spots are so you have an idea, like right there is a really bad spot, right? I don't want to go crazy hard on any of this, but definitely in the worst of these. I could bring her off the table here in about 2 seconds if I hit that thing. Yeah. You want to see her squirm real quick? Okay, I get right on that thing. All right, rolling pin 101. It could be a small one like this. It could be a longer one, or you can get a stick. They call it the stick. It's like a more professional grade thing. They use them with athletes. But if you got one of these, it's strong enough handles, this is fine. All right, and the person can do this on themselves, but I'm going to show you how to do it on her. And what you want to do is go just below the bone. You don't want to press on the bone. It serves no purpose except to anger your spouse. And then you lose all those brownie points you earned earlier, okay? But what you want to do is put a little bit of downward pressure and just start working your way up and down here, okay?
And it is normal for this to be very painful.
It is normal for this to be the case. If you're a cyclist, I guarantee you've got tight IT bands unless you've been actively working on this. If you play soccer, you will have the tight IT bands. If you're a truck driver, okay, pretty much if you are alive, you will have tight IT bands, okay? It's a very rare person that doesn't have some of this contributing, okay? And as you get into the back part here, you're going to get a little bit into the hamstring as well. For her, that's actually a little bit more tight than the other one. Must be from that leg workout the other day, right?
Yes.
Thank you, Christine, for those exercises. All right, so all you're doing is this. And this isn't like the trigger point where you're doing it for just like 8 or 10 seconds. You can go up and down multiple points, okay? 10, 15 repetitions up and down like that. Now, I'm doing this on somebody else, but you may want to actually practice this. You can actually come on up now, okay? You may even want to practice this on yourself, okay? How would you do this? I'd be sitting in a chair. Let me come over to the other side here. And just like where the pant, seam is here, I want to get into that just below my hip and start rolling. And it's nice because you'll actually get a sense of how much it hurts before you hurt somebody else, okay? Because some muscles can take a ton of pressure. This is not one of them. And it's nice. I love doing this roller here. You do this. You can actually do it in the back of your leg with your leg down like this. Get your hamstrings right to that sitting bone. You can go on top of the leg like this. And on the inside, you can work all 4 sides of the leg muscle in about 30 seconds. It doesn't have to be the slow, methodical, 15-minute thing. You literally get in there, work on this thing, warm it up, okay? Get it circulating and makes a major difference, okay? We also have like a small example of basically like a foam roller. This one has like kind of the studded portion to it. And what you do is put it on...
Don't fall off.
Yeah, I'll try not to fall off this. I'd usually do it on the mat, but just for ease here. And I'd lay it like this and put a little bit of my weight on it and just slide along and let my weight push into that. Now, this can be very painful for someone who's never done it before, and you may think, I'll never do that again, but if you do it over time, you will break up those muscle knots even more than you could have ever imagined with even like the rolling pin, okay? As long as you can put yourself in like a side plank. And a bigger version of that would be something like this. This is more of a portable, traveling one. So something like this could be used too. These are phenomenal ways to do therapy at home. If anybody does like CrossFit or anything like that, they're always doing these types of things to keep themselves functional so that they can lift the weights and be very active, okay? All right, so let's get this out of the way. All right, so now we're going to learn from our dogs, okay? What can we learn from our dogs? Well, one is sleep all day, okay, but you don't want to do that. People are doing enough of that. Thus the quarantine 15 that everyone's picking up. What is the dog doing here? He's teaching his owner downward dog. It's a tremendous way to stretch. It's a yoga pose. Yoga is a phenomenal way to gain heat and flexibility and strength in the muscle all at the same time. So as we're going to talk about different exercises, definitely consider yoga as well to generate a lot of flexibility. But what I want to do is basically show you dynamic stretches first. Now, if you're not an athlete, you may not need to get into dynamic stretching, but it is a great thing for anybody to do. In fact, most of the research shows if you do dynamic stretching versus static stretching, and you'll see what I mean by dynamic. Static is just holding one position for a period of time. Dynamic is with movement, and the circulation increases with that. Thus, the flexibility can be more significant. So we're going to show you a series of them right now. Like she's doing kind of a passive stretch, but if she was going into a movement doing that, like I'll show you, that's dynamic. All right, so I'm going to try not to trip on my cord as I do this, but as I do, if I do, leave a comment if you thought it was funny. All right, so a forward lunge with a lean. So with this one, what you're going to do is basically put one leg forward like this, bend the knee, and then try to reach down past your toes a little bit. Okay, then come up and then go like this, okay? And it's pretty simple, almost like you're just doing like a leg, a squat with one leg, okay, in a reaching position. Why the reach? What I'm doing, instead of just using my legs, I'm engaging my upper torso as well. So all of my back muscles coming from my low back all the way up my shoulder into my neck are actually being engaged by doing this. So this is a really great way to do this. And you can do like a lunging situation like this, one at a time. That's a phenomenal, simple way to get all those muscles loosened up. There's a side lunge with a lean, okay? So what does this do? So you obviously want to pay attention to where your knee is when you're doing this. If you want to do an exercise, you don't want your knee to be way past your toes. That will put stress on it, and that's way too much. So a side lunge with a lean is basically leaning like this and going to the side like that. And then to the other side, to the side. If you want to add a little bit to it, you can reach up and over as you do it, engaging your whole body. You'll actually find that you're going to increase your circulation in your whole body as you're doing these different exercises as well. So they're not, other exercises are going to be very static. You won't feel that increased circulation at all. A straight leg kick, okay? So this is almost like a martial arts type of thing. So I'll raise my left leg to my right hand like this and do like 3, 4, 5 of these in a row. And any of these you want to do anywhere from 5 to possibly 10 at a time, engaging those muscles. You want to keep it as straight as you can, but if you're not that flexible, it could be a little bit bent when you do it, but over time you're going to find that hamstring will become more flexible and then basically loosen it up. Knee to chest. This is a great one. You can do this in bed, which would be more of a static way to do it, or dynamically when you're standing up. So it's basically grabbing your knee like this and grabbing like that. And you do that back and forth, one at a time. Okay, if it hurts your knee to do that, you can grab behind the leg and pull up like that, because you don't want to hurt your kneecap by stretching it like this. So again, pulling that up, pulling it up like that. Arm circles. This is a big one. A lot of people have that neck tension like we talked about. So what you want to do with arm circles, they can just be as simple as like down here. If you have a lot of shoulder issues or problems, if you have moderate shoulder tension but no real pain up there, you can get into these little circles like this. Thumbs going forward, thumbs going backward. Or you can do bigger ones like this, like a windmill, or like a full circle like this. It depends on how much you need. When I do this, I can feel my pecs, my deltoids, my rhomboid muscles, the whole gamut of things. So if I was going to play basketball or throw a football around with the kids, then this would be a great exercise to do. Do one at a time, if it's going to be the full circles, because it's kind of hard to do and really awkward looking, okay? So definitely consider that. You may even want to use something like a stick here, okay, which is a super helpful way to do it. A lot of people will do this where they use a stick to help engage their muscles, and it helps them to keep everything locked together, and it really uses the shoulder muscles more than just the pec muscles as you do this, okay? So that's a way to do it over time. You get your arms closer together and see if you can do that, which I cannot right now, I'm too tight, but you can bring one arm over, come down like this, and then do these kind of circles like this, okay? A lot of people have shoulder issues as well, where they can't really reach things really easily. That's where a stick like this can be super helpful. So you can actually grab on top of it like this, and you use your other arm to help push it up. So if I can only reach up to here because of stiffness, how am I going to get more flexibility? So you can use like a stick or a cane even to kind of push that arm up a little bit to increase the stretching into those muscles. So that's a great way to do that as well. But something like this is just basically a PVC pipe. I think it's 1.5 inch here, okay, 1 inch, excuse me, which would be a great option for you to use that as well. So people don't have to buy expensive equipment. They already have the rolling pin, maybe some PVC or some kind of a broom handle at home. You can use those things. Don't spend a lot of money on something you're not going to get into a habit of. Start small and then work from there. And then the swimmer stretch. If anyone watched Michael Phelps break like every record on planet Earth in terms of swimming or any swimming event, okay, that's what they do. They do these dynamic stretches. They're kind of throwing their arms back and forth like this. If your shoulders can handle it, it's a phenomenal way to get everything loosened up. By doing that, before you're going to go into an exercise routine, doing some planks or doing yoga and things like that, the more you stretch these things out, the less apt you are to overstretch or strain those ligaments or tendons and cause damage in there. So that's a phenomenal thing to do. All right, so now that I'm out of breath from my dynamic stretching and I'm warmed up for it, we're going to do some more passive stretching, okay? And this is like the static form. This is by far one of my, oops, I went back there. All right, we'll find it. There it is. The doorway pectoralis stretch. This is huge, okay? We don't have a doorway right here, but if I had one, just like this person, you'd be standing right in a doorway with one arm against the one side, one arm against the other, and leaning forward. That's huge. What you're going to feel is the stretch across here. This is important for anyone that's got that slouching posture. Why is that? Because when everything's tight in the front of us, we type all day, we lift things in the front, we brush our teeth, comb our hair, all the muscles in the front get tighter. So when that occurs, we tend to get this rounded shoulder. And that's why a lot of people are shorter as they get older, because they're actually getting more anterior, forward, okay? And their head's going forward, and it puts tremendous tension here. So as the muscles in the chest get looser, they start to loosen up. Shoulders fall back, head comes up, breathing improves. A lot of people with asthma and challenges, we're talking about COVID-19, okay? A massive condition putting people in the hospital, but basically a lot of people that have susceptibility are people like get asthma and other breathing conditions. So when people have this very shallow form of breathing and they're very closed posture, it actually reduces the amount of oxygen transition from the upper lung to the lower lung. So as you open up your chest cavity, it increases the oxygenation in your tissue. I definitely recommend doing that in general, and definitely during respiratory situations. All right, so that's a great stretch. You want to do that for like 2 or 3 stretch cycles, about 8 to 10 seconds, and then relax, do it again, and breathe as you do this. 2 to 3 breath cycles is about 8, 10, 15 seconds. That'd be perfect amount of timing. All right, pectoralis minor, that'd be like using the broomstick like I showed you. That's a great way to do it. You can see you're going to get slightly different muscle fibers here by doing that. The rhomboid, okay, that stretch I talked about with the swimmer, okay, back and forth. A sustained stretch like that would be like holding your arm across your body like this and holding it here. So you can see the back side, I'd be stretching everything along my shoulder blades. So if you have a lot of chronic rib pain and tension back there, and it always feels like it's stiff and just needs that massaging in a sense, do your trigger point therapy first, but then maybe follow up with a little bit of stretching afterwards by doing this. And all you're doing is just bringing your arm across your body to increase that pressure. Again, 8, 10, 15 seconds, breathing as you do it. The scalenes, this is a huge one. Now this is talking about sitting down when you do this. I'm going to do it, well, let me demonstrate seated just so you can understand it fully. All right. So it says to basically sit on your hand while you do it, or grab on the side of the chair. I like sitting on the hand because basically you lock your arm down, but if it's not long enough to do that, just grab on the side of the chair like this. And what you do is you can just drop your head to the side, which is one way. We're going to do 3 stretches in a row. Okay, so the next few slides are going to correlate with that. So purely to the side is going to be the scalene muscles here. I like to put a little bit of added pressure on this when you do it because I don't think you can push your head enough with the muscles to loosen the muscles up. So use a little bit of overpressure there like this. It locks my shoulder in here. I get this stretch, 8, 10 seconds of breathing, pulls those scalene muscles. Then what I want you to do is to look like at 45 degrees from there to the side and then pull in that direction. Okay, see how I'm pulling? My chin and eyes are facing that direction and I'm pulling in the same direction. That's going to get the upper trapezius ones that we talked about earlier. Huge contributor to headaches, okay? Phenomenal way to help reduce that. Next, I want you to look completely 90 degrees. As Shirley says, I get geeky here, so I'm talking about degrees. Looking to the other corner of the room this way, but you're going to pull the same exact direction that you just did. What I'm going to do is then get something called the levator scapula muscle, which is one of the elevators of the scapula, basically your shoulder blade. That's huge for the people that are chronically carrying tension, from carrying a purse or a briefcase or backpack or talking on the phone. When that muscle gets tight, it can cause that almost spasm feeling. I see this all the time with people. They come in and their neck's in a spasm, they can't get out of it, and it's basically doing that same exact stretch. So again, 8, 10 seconds, so it's nice. Real quick, run through again, to the side, 45 degrees this way, looking over there, going the other direction. And lastly, there's also one right in the base of the skull for the suboccipital area. Okay, so what you want to do is tuck your chin just a little bit and then put a little bit of overpressure, almost like you're pulling forward, not just down, forward, to cause a little bit of stretch up here. This is an area that's huge, and in fact, in a moment, I'm going to have Dr. Shirley come back over. I want to show you one more trigger point area that's huge, because if you can reduce tension there, you will definitely help with headaches in the future. If someone has a headache, work on the knots down here, work in the base of the skull, and you will help 50% of people right away just by putting some pressure on that. And let me just finish up a couple of these static stretches, upper trapezius, Okay, the suboccipitals like we talked about. And then I'm going to show a couple leg ones, and then we'll have her come back over and I'll show you that trigger point area there, okay? This is a big one. Everyone's seen the example. These are called your hip flexor muscles, okay? And what they are is they're the muscles that basically allow your leg to come up and do this. This is a big deal, okay? Just like if you've seen anybody that lifts way too many weights and they're not very balanced, okay, the macho man, and they walk around like this and they can't straighten their arms because their arms are so tight. Those are arm flexors, okay? Why is that a big deal? If their muscles are too tight, they can't straighten them out. But they can walk around like this and it just looks kind of awkward, but it's not going to be the biggest deal in the world. But if your muscles in your hips are too tight, you can't walk around like this, okay? Some people do, but what happens is they straighten out, but they never feel like they're able to stand up completely straight. So the hip flexor is when you sit too much, these muscles get tight and you want to stretch them. Or if you play sports with kicking, taekwondo, martial arts, soccer, they're going to definitely get tight. So we showed that stretch before. We were doing this lunge. This one's static, but basically you can put your knee on the ground. Okay, hopefully you can, I'll do the outside one here. Okay, you put your knee on the ground like this, something padded. This is my support leg, and you're going to lean forward like this, and you should feel a really good stretch in your groin. This is phenomenal. Take it slow with this one, but if you loosen these muscles up, it'll have massive improvements, not only in your hips, but also in your low back. Because the thing is, when these hip muscles are too tight, it's going to put tremendous pressure on that low back. So for anybody that has this, and I see it very often with women, they have this pinpoint pressure right in that low back, where if you put even the smallest amount of pressure, it'll shoot them through the roof, because that's being jammed all the time because these muscles in the front are so tight. So that's a very helpful one to try to work on. Ta-da! Okay, people are asking about the sciatic nerve, okay? This is the best stretch in my opinion, and I longed for the longest time to be able to do this stretch, because after I had my sciatic nerve problem, I couldn't even get in this position for almost 2 years because the muscle was so tight in my cheeks. So the best way to do it is this. You're sitting like this, and whichever side you're going to try to stretch, okay, in this case my left side, you would cross the ankle over the other one if you're able to do this, okay? And some people, if it's really tight, you can't even get the leg up there. But you're not crossing like at the knee like this, it's the ankle over the other knee. Then keeping my upper body as straight as possible, lean forward until you feel a stretch. You don't have to go very far. I'm talking just that little bit until you feel a stretch in the buttock area there. If you feel a pain out here or up here, you're not doing it right. If you feel it in your groin, you're not doing it right, or something's excessively tight somewhere else, you should feel it right in the buttock area. So ultimately, right about here. Okay? So I want to show you a laying down version of this. If you can pan down low enough, that would be great. Can you see me down here? All right. So this is a great one. Same exact thing, just like I was sitting. Except what you're going to do is you're going to grab behind your leg like this. So I put one hand between my legs, the other one behind it like this. So it's a real relaxed position, and you pull up towards your chest. And it's going to feel a tremendous stretch here in the buttock area. If it's hard for you to hold that leg or really reach without straining, you can put your foot up on something. Like let's say this was a wall. I could put my foot on that and then scoot myself forward, and that wall is going to do the pressure for me, drawing my knee up towards my chest more. And I can just sit there statically for 10, 15, 20 seconds, deep breath, and go through that. A phenomenal way to do that, okay?
Wanda says that's exactly where hers hurts.
All right, Wanda, well, I hope that helps you a lot, because it hurt me for a very long time. If you sit a lot, it's definitely one of the muscles that's going to be most tight. But if you do that stretch, even a little bit can have massive, massive improvements. And I really want to tell people, this is taking a while to go through these different exercises, but when you get into a routine, you can pick 2 to 4, 6 of your favorite stretches. It may take you 5 minutes, and that would be about it. And I've worked with people for 20 years. I met them in the first weeks or months of practice over 20 years ago, and I know people that were on edge of getting surgery back then, and I know them now 20 years later, still no surgery. And the people that have done a little bit of stretching every single day, or 5 days a week throughout those 20 years, have done phenomenal. So that little bit of investment will save you a tremendous amount of pain and heartache in the future, okay? So sitting piriformis, laying down piriformis, whichever one. You may want to look up that one, understand that muscle. It's a very thin muscle, but the sciatic nerve goes right underneath it, and that can cause tremendous amounts of pain. The cat stretch, Dr. Ben loves this one. Cat and the cow stretch. Again, I'm going to get on the floor here. So the cat, what does the cat do to try to look big and tough? Well, it basically gets down like on its fours, because that's where they hang out, and it spreads its back like this, okay? And it raises that arch. What does a cow do? It just sits like this all day, dropping its belly in the ground and the udders, hanging in the grass. So the opposite of that is cat, cow. And you want to do this through like a breathing cycle. Cat, cow, okay? And basically by doing that, you're mobilizing the spine. So where Dr. Shirley showed you earlier where those nerves can get impinged, you can actually help to improve circulation. Because who's going to do this when they're standing? It just feels really awkward. But when you're laying down like that, it's a beautiful stretch. But make sure you do some breathing while you do it. All right, so here we are. Dr. Shirley, we're going to pull you up because they were just so stimulated. Everyone would like to settle down a little bit now, maybe take a nap. And we're going to let Dr. Shirley back into the scene here. I love her, and we got to pick on each other. How could that smile make anyone fall asleep? Not a
All right.
All right, well, good job, Dr. Joe. Awesome.
Thank you.
All right, so we're going to close up with some final thoughts here. So it's important after you've done all this work to drink a lot of water. And in general, drinking water will help keep your muscles loose. It's very, very important. They need to be hydrated. A dry muscle is more likely to be torn or injured. So drinking water is vital. An Epsom salts bath. How many of you out there have done an Epsom salts bath? Let us know in the comments. This is a fantastic, relaxing experience. I've seen many times when my husband's disc has flared up and he goes and soaks in the tub, and it definitely helps a lot. Now, the only thing is afterward, it's a really good idea to ice because heat can often cause inflammation. And even though the Epsom salt, which is actually magnesium, by the way, and it just leaches right into those muscle tissues and just really helps to relax the muscle. But the heat can feel really good at the time, but afterward, it can definitely cause a little bit of inflammation. So afterwards, you ice. So soak in the bath for 15 to 20 minutes. Use about 2 cups of Epsom salts for a full bathtub. You can throw in a little lavender or some essential oil if you want to have a nice sensual experience. You can smell all those wonderful smells and get nice and relaxed, and that should definitely help. But then ice 15 minutes afterward. So some natural inflammation reducers, okay? There are a lot of great things out there that can really help. Again, having lived with my husband who has 3 herniated discs, there's times that he needs to basically live on some of these things. Boswellia has been fantastic for him, okay? Boswellia is a natural anti-inflammatory, so that helps to pump that inflammation out. Now, this is an herb, so of course, if you're taking medication, you need to make sure there's not going to be any interactions. WebMD often has a really nice interactive tool to see if any drugs will interact, and you could talk to your pharmacist, or really the pharmacist is going to be your best bet. And turmeric, this is a hot topic nowadays. A lot of people are taking it, and it is fantastic. I mean, they've used this for thousands of years to really help with inflammation, so definitely another good option to try.
Great little note there for turmeric. Don't worry about the mic. Turmeric has actually been shown in many studies to actually have an inflammatory mediation control, which basically means a lot of people are hearing with the COVID situation right now, it's an excessive amount of inflammation that occurs in the body, and they're actually finding that turmeric can have a kind of a mediating of that over-inflammatory response. So it's not only good for musculoskeletal things, but any inflammation throughout the body. So it's definitely something to consider as kind of a low dose, long-term use for a person, especially if they're immune sensitive as well, to help reduce risk of excessive over-response of your immune system if getting sick.
Great. See, he had to go geek on us, but
sorry.
that's okay. All right, Ice Ice Baby. Okay.
I'm gonna dance now. Oh wait.
Do, 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 do. Yes. All right. So ice is fantastic. Now listen. There are people that say, oh, heat is better, and everyone gets confused. Ice or heat, ice or heat. We always say try ice first because ice naturally is anti-inflammatory. It shuts down the inflammation from coming to the area. What is inflammation? Inflammation is an overreaction of your body because when you have an injury to your body has to make sure there's not a cut somewhere where your body can get an infection. So it sends all these white blood cells and all these other things to the area causing inflammation. If it doesn't need to be there, you ice it, it gets rid of it, okay? So icing is very helpful. 15 minutes, at least three times a day. If you're in a lot of pain, once an hour, but no more than once an hour, 15 minutes at a time. And the best thing, since a lot of you have time on your hands, the best thing is to do 10 minutes of heat, 15 minutes of ice, but always end with the ice. Now, if the ice makes it worse, then guess what? Stop and try heat. There are occasionally, I have myself, even though that video that we did this morning was a joke, I've actually had that happen. So that's why my acting skills were just amazing, because I've been there many times where I slept wrong and I'm like, Joe, my neck. Okay, if you didn't watch our video from this morning, it is hysterical, I have to say, and we did it on the first take, which was pretty impressive. So anyway, it was really fun, so definitely check that out. But bottom line is that I have definitely been there, and there have been times where heat was better, but 9 out of 10 times ice is going to be what handles it, so definitely try that. So I want to know, how many of you enjoyed what we did this evening? We're contemplating doing a part 2, possibly either next week or the week after. So in the comment section below, let us know if you'd like to go a little deeper. We can go more into some of those things that can help sciatica. We can show you more trigger points that you can work on and just take it on a deeper level. This was meant to be an introductory at-home care program, but we're definitely willing to put in the time and help you guys out, because we know we have at least another few weeks here of self-quarantine, so we don't want you guys to suffer. You know, like I said, we are available for people. If you have a pain level that is heading in the direction of requiring you to take medication or something like that, you can absolutely come into the office. We have a little bit of altered hours, but you just might want to call ahead and see when we're there. But we're definitely there. But for those of you maybe that are just afraid of getting worse, or we're on a maintenance routine, we get it. You know, when you're not doing your maintenance care, eventually you're going to end up with a flare-up. And that's what we're concerned about, is we're going to have a bunch of people going backward, and we do not want that to happen. That's why we're investing this time to try to help you guys. We don't want you to lose all the ground that you've gained. So please indicate whether you'd like us to do that. If we get enough interest, then we'll definitely put the time in and do that. And make sure you guys are following us on YouTube, Southside Chiropractic. We have all kinds of videos. A lot of people are putting on that quarantine 15, which is that extra 15 pounds that people are gaining on the quarantine. So we recommend go through, binge on some of Dr. Joe's geeky intermittent fasting videos. And he does keto videos. There's lots of awesome information. Instead of binging Netflix, since you probably watched them all anyway, binge Southside Chiropractic videos, and I think it'll be worth it. So by the end of this, you can actually be healthier instead of sicker. So we want to thank you guys for watching. Now, we have a special offer that we're going to give you guys. If you are interested in getting a very detailed compilation of all these different exercises and stretches that we've put together, private message us with your email address, and we will, over the next few days, we're going to get those together and we will email those out to you. So all you have to do is private message us, and we'll send you these in PDF form, and that way you can get started on that. So
there are dozens of more stretches than what we went through tonight. We didn't want this thing to take forever, but it's a way for you to pick and choose a very specific set of stretches that will help you, not just what we chose for you tonight.
All right. Well, we want to thank you guys so much for watching, and we hope that you have a great rest of your evening, and stay tuned, and maybe we'll be doing something for you next week. So thank you very much.